How accurate is self-checking your stomach for pregnancy?
Hello there. If you're watching this video, you're likely curious about how accurate it is to check your own stomach for signs of pregnancy. We'll discuss this method, its reliability, and the science behind it. We'll also cover better ways to confirm pregnancy. Remember, self-checks can never replace a proper medical examination.
What does checking your stomach for pregnancy involve?
The practice of checking your own stomach for pregnancy involves feeling the abdomen for changes that might suggest a pregnancy. Some people might expect to feel a hardening or rounding of their stomach or perhaps even movement. While these signs can occur during pregnancy, they are typically noticeable only well into pregnancy, and they can also be caused by numerous other conditions or factors.
How accurate is this method?
The short answer is, not very accurate. Changes in your stomach that you might be able to feel typically occur later in pregnancy. For instance, you may start feeling your uterus harden or expand around the 12th week or later. Feeling a baby move usually doesn't occur until around 18 to 25 weeks for first-time pregnancies. It's also important to remember that many other factors can cause changes in the feel or appearance of your stomach, including weight fluctuations, bloating, or digestive issues. As such, it's quite possible to misinterpret these signs and either mistake a non-pregnancy related change for pregnancy or vice versa.
What are more reliable ways to confirm pregnancy?
A far more reliable way to determine pregnancy is through a home pregnancy test or a blood test from your healthcare provider. These tests measure the level of human chorionic gonadotropin, HCG, a hormone produced during pregnancy. Home tests can be performed as early as the first day of a missed period, though waiting a week after a missed period can increase accuracy. Blood tests can detect pregnancy even earlier and are the most accurate. Moreover, a medical ultrasound is the most definitive way to confirm a pregnancy, as it can directly visualize the developing fetus. Ultrasounds are typically performed after 8 weeks of pregnancy, when the fetus is more easily observed. In conclusion, while it's natural to observe changes in your body when you suspect you might be pregnant, checking your own stomach is not a reliable method for detecting pregnancy. Instead, if you suspect you're pregnant, consider a home pregnancy test, or even better, schedule an appointment with a healthcare provider for a blood test or ultrasound. These methods are much more accurate and can give you the reliable results you need.